I'm Dr. Daniel Amen, the author of The End of Mental Illness. I'm a physician, a psychiatrist, a brain imaging researcher. At Amen Clinics here, we've built the world's largest database of brain scans related to behavior, more than 160,000 on people from 121 countries. And what the images taught us is that most psychiatric issues are not mental health issues at all, but rather they are brain health issues that steal your mind. And this one idea changes everything. Get your brain right and your mind will follow. Being a psychiatrist for a very long time, I realized a long time ago that no one really wants to see a psychiatrist. No one wants to be labeled as defective or abnormal, but everybody wants a better brain. In The End of Mental Illness, I talk about, well, what if we reimagine mental health as brain health? And when you do that, you decrease stigma, you increase compliance, you increase compassion and forgiveness from families, plus it is more accurate. With a better brain always comes a better life. Help me end mental illness now.
We first started noticing challenges in Jared's behavior really in his preschool years. He had an internal motor that just would never shut off. He had trouble sleeping, he had trouble communicating, he had trouble with friends. We took him to the doctor, a pediatrician. I remember the pediatrician telling me that he's not supposed to diagnose somebody at 5 years old, but Jared was so hyperactive and had such lack of focus that he actually gave him a diagnosis at the age of 5.
My attention span was just not there. You could talk to me for 5-6 minutes and I would lose interest 3 or 4 times in that 5-6 minutes.
We typically got called in to the school, and especially were held back afterwards to talk about what happened that day at school. It was very hard with Jared to parent him.
I would be mad for no reason and I couldn't even control it.
The physician that we were seeing at the time wanted to put him on anticonvulsants and antipsychotics. I was not comfortable with any of those, and I knew that my son's behavior was not related to his personality, it was related to the disorder. We took Jared to a psychiatrist, psychologist, a neurologist, and other pediatricians that specialized in ADD, and we still didn't get the results that we were looking for.
My parents, they really felt like this is enough. Like, obviously the stuff we're doing isn't working, something needs to change. I just thought that I was just, like something was wrong with me, and I didn't know how to fix it.
So my husband and I were really at wit's end when a friend of mine told me about the Amen Clinics and the ability to actually look at the brain. We did a lot of research and we decided to give this new approach a try.
So after I got my scan, I learned that I had a specific type of ADD called ring of fire, which pretty much means that my brain was firing on all pistons 24/7. I learned that it wasn't my fault that I was having these problems, that it was my brain.
As a mother, you struggle with not being able to fix every issue your child has. And when I saw the scan and realized what was going on with Jared in his brain, it made me realize that I was not in control, nor was he. And what we learned was that his behavior was based upon brain dysfunction. It all made sense because you could actually see what was going on inside of his brain. So the doctor explained to us that the medication that Jared was on was not appropriate for his type of ADD. He was really looking at all of the aspects of his life and helping us with the treatment.
brain function in these really cool 3D images. And it taught me that I was really not dealing with mental health disorders, I was dealing with brain health disorders. And when I helped optimize the physical functioning of the brain of our patients, they got better faster. When I opened our first clinic, July 5th, 1989, I had no idea what it would turn into. Over 30 years, we have about 40 physicians, 8 locations around the country, and we are just so grateful for the people that we have been able to help. In 1995, we actually brought the SPECT cameras into our first clinic in Northern California. It was so exciting. It's really when I started looking at the brain on virtually all of my patients that I knew that we had to create a revolution in how mental health care was practiced. 1999, I published Change Your Brain, Change Your Life, which was a New York Times bestseller. It was published in 33 languages, and then all of a sudden we started seeing people from all over the world, which was really exciting to walk into your waiting room and see somebody from Russia or China, Japan. And so the word began to spread on our work that we do psychiatry and mental health treatment differently than most of our colleagues. In 2008, I did my first national public television special, Change Your Brain, Change Your Life, and it was very successful. And I'm now actually in the process of writing our 14th public television special at the end of mental illness. So we're really grateful for our partnership with public television, and our goal is to educate everyone, to fall in love with their brain, and then to know how to treat it. We have published 70 professional papers, some of the biggest imaging papers ever done. We published one on our ability to separate post-traumatic stress disorder, PTSD, from traumatic brain injury, TBI, and we could show that scans could actually separate them in pure cases with nearly 100% accuracy. In 2009, we started our NFL work. So we did the first and largest study on active and retired NFL players, showing high levels of damage at a time when the NFL was struggling with this issue. But, you know, I think that didn't surprise us, right? I actually don't think it surprised most thoughtful 9-year-olds. You know, if you get hit repeatedly by huge people, it's going to cause damage. But the exciting news from our study is that 80% of these brains get better when you put them on a brain healthy program. Here at Amen Clinics, we have been blessed to see just remarkable people. In our database of now over 150,000 scans, we've seen little kids, 9 months old is our youngest patient. Old people, 105 is our oldest patient. We've seen people from every socioeconomic level, high-level athletes, including the likes of people like Muhammad Ali, children with autism, adults who have bipolar disorder, schizophrenia. If you walk in our waiting room at any time, it could be kids with learning disabilities or older people who worry that they don't want to get Alzheimer's disease. I am so excited to share this 30th anniversary message with you, and we're not done. That's why I work really hard every day to keep my physical body and brain healthy, because I know we need to change how psychiatric medicine is practiced.